And it causes in the congenital in a newborn.
Yeah.
Yeah, in a simple way.
Exactly. Yeah, it's very good. So congenital heart defects is some kind of the defect, the abnormality. Firstly, it's the abnormality in the heart, and it's often appear from the kind of in the neonatal, or even it's from the fetus, and mostly it's the kind of anatomy. It's anatomy defect, right?
Yeah,
So yeah. So as you talk, exactly it's some kind of abnormality in the heart generally. Okay, and
yeah,
um, and that congenital heart defects is a kind of a broad topic, and
Yes. Be-
yeah,
yeah.
and so we need to kind of divide into some category so that uh, we can kind of approach to the diagnosis.
Mhm.
So, do you have any idea about the kind of classifications of types of heart defects, of kind of congenital heart defects? Have you
Acynotic
ever?
divide into
Yeah.
big part. This is a cyanotic congenital heart defect and non-acyanotic, right?
Yeah,
Yeah.
exactly. We have many types of classifications, but in clinical situation, we often divide into two types. So it's kind of easier for the physician to approach to the patient and give the diagnosis. It is the cyanotic and acyanotic, two main types. Okay, and
yeah.
do you know what is acyanotic? You know it? You know this word?
Yes, I know it.
Yeah. Can you say something about acyanotic types of heart defect?
Uh, well, a cyanotic. Okay, in a simple way again. I think that the congenital heart disease, most of them has a sun. It's like an abnormal
Mhm.
um yes, an abnormality movement, an
Mhm.
abnormal movement of the blood, of the
Mhm.
blood flow. And if the sun is from the left to the right, it can't cause the cyanotic because from the left side is the blood with full of oxygen, and yeah, it makes the blood red, and so it doesn't cause cyanotic. And yeah, that's a that's one reason. And I'm trying to read the slide.
Uh-huh.
Okay.
Okay. Uh, okay. And another cause is the outflow obstruction, caused by something that obstruct the flow of the blood, maybe uh in the artery, and artery in or in the pulmonary. Yeah, that is
The
Mm.
artery in the stomach.
pulmonary artery and
Yeah. The outflow obstructions. You refer that it has the types of pulmonary stenosis, right? Do you
yeah,
know stenosis? Do you know the
yes, I
meaning of
know.
stenosis? Yeah.
Yes, I know this word.
Yeah. It means that we have a
Mm-hmm.
narrowing of the pulmonary artery, so
Yeah.
that
Mhm.
it will decrease the blood flow to the lung.
Mm,
Okay.
yeah.
And um, yet you you are very kind of prepared, very good about this topic today, and I can refer that we have two types of congenital heart defects. It is acyanotic and cyanotic heart defects. And acyanotic it means that the patient will have no symptoms of cyanotic. It means that if the if the blood from the right the right ventricles from the right ventricle to the left ventricles, it means that we will have the deoxygenated blood
Yeah.
flow to the systemic circulation, so that the patient will have the symptom of cyanotic. You know,
Mhm.
yeah. And uh, on the other side, the cyanotic means that the blood from
Mm,
Right.
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 right the right to the left, so that the patient will have the symptoms of kind of paler, kind of cyanotic outburst, kind yeah. And today we will talk about um, the aspect of acyanotic, yeah, congenital heart disease.
Mhm.
Mm-hmm.
Yeah.
In acyanotic heart disease, congenital heart disease, we also have divide into two subtypes, right? The first is the left to right shunt, and the second is no shunt ignition. So
Yeah.
I just refer in this slide and defect in congenital heart disease. But it's not all. We have many types of congenital heart disease. But here I just kind of refer some most the most common defect.
Yeah.
Okay.
Yeah.
Yep. And so with the symptoms of congenital heart disease, the patient the patients will have symptoms of cyanotic in the group of cyanotic congenital, right? But in the congenital heart defect, the patient often complain with some symptoms as not they are that's not kind of specific for any disease, but it just kind of try to explain, to try to kind of to refer for the physician
Yes.
to yeah to think about it. And you know, not not every congenital heart defect can kind of um, kind of diagnosed in the early times of this infant. It's often diagnosed very kind
Late stage of the group, right?
unintentionally.
Uh-huh.
Uh, mhm. For example, the child when the child go to the local clinic for vaccinations or just for some routine checkup, and the local health staff just try to use the stethoscope to hear the heart sound, and and the healthcare staff receive some abnormal in the heart sounds, and he or she will refer this child to some expert,
Mm-hmm.
refer to the cardiologic pediatrician.
Mm-hmm.
So yeah, so it's very important to to know how to hear the heart sound, how to kind of um to how to know the abnormal in the heart
Yeah.
sound. Yeah,
Accusation. Yep.
yeah, of a trial. And I just show you a slide of the some locations of the valve, so that
Mm-hmm.
we can, when we hear, when we kind of occultation the heart sound, we can we can receive the locations of the vowels.
Mm-hmm.
Yeah, and it will refers to the abnormal. Which
Mm-hmm.
abnormal we can think about?
Mm-hmm.
Okay, and here we have, yeah, we all know that we have four vowels.
Yes.
Yeah, in the heart. And can you see here? Um, there are two vowels we can hear in the sternal coaster.
Mm-hmm.
Mhm. The upper one is the pulmonary valve, and the lower one is the tricupid valve. Okay, yeah, beside the sternal coaster, and the mitral valve we can hear, yeah,
The mitral valve, uh,
in here, right?
the apex
In,
of the heart. Yeah.
in yeah, in the fifth intercostal space, right? And the last one is the right sternal coaster, the only valve we can hear in the right sternal coaster, right?
Mm-hmm.
You see it? Mm-hmm. So you should remember the locations, the position of the valves, so that it will reveals some information about the defects of the tribe, because occultation is the first symptoms that we can hear when we do the medical checkup for a child. Okay,
Mm-hmm.
so now just some kind of general information about some congenital heart defects for today. So now we will move to our Miss. Okay.
Yes. Yes.
Miss, yeah, the follow topic of acyanotic congenital heart defects. Yeah. So now we will kind of move to the first case.
Yes.
So
Can you zoom in bigger? Like we just only see one slide. That's better. Then. No, yeah. Yeah. I think that's better. Good.
mhm. So when can you read it out loud?
Yes, of course. Okay. A 3-year-old boy is brought to the physician for a well child examination. He feels well. He was born at 38 weeks gestation and weighed um, to 2,766 grams. He now weighs 14 kilograms. There is no personal or family history of serious illness. His immunizations are up to date. He is at 60th percentile for height and 55 percentile for weight. But vital signs are within normal limits. The lungs are clear to auscultation.
Mm-hmm.
A grade 3 out of 6 systolic ejection murmur is heard along the upper left sternal border. As to it, south to I think is widely split and does not vary with respiration. There is a grade 2 out of 6 mid di- diastolic murmur along the lower left sternal border. The abdomen is soft and non-tender. There is no organomegaly. Which
Mm-hmm.
of the following is the most likely diagnosis? A. Patent ductus at- arteriosus.
Mm-hmm.
B. Benign heart murmur. C. Atrial septal defect. D. Ventricular septal defect. E. Pulmonary valve stenosis. F.
Mm-hmm.
Coa okay, this word coarctation
Coarctation.
of the aorta.
Yeah, coarctation of the aorta.
Yeah, thank you. So before we can kind of elaborate the situation of this case, uh, I want of us to kind of know more about the new words in this case. Do you have any new words you want to explain more?
Alright. In fact, I I just search for the meaning of all the words if I don't know the meaning, but I just wonder if the weight and the height of this child is in the normal range.
Yeah.
The 16th percentile of height and 55 percentile for weight is normal.
Mm-hmm.
Did you do any search about the word percentile?
Yes, I know the meaning, but I don't know the normal range.
The normal range.
Yeah.
Um, every tries in the from the fifth percentile to the 95 percentile is in the normal range. It's from
Yeah.
the negative to standard deviation to the positive to standard deviation. Do you know standard deviation?
Yes.
Yeah. So
Yes.
this one is totally in the normal height and a normal weight.
Okay.
Um, for standard deviation, it means like you compare to the general population with that number, and the average will like this will run closest. If it's like very high or very low, it means like the weight or the height of the child is out of the normal range. Like 50%, it means like that's the not the part of the standard deviation. So if you move to up like near 100, it means like this is out of the normal range. Mean like and this down to the zero, mean near close zero. This means like this is degrees compared to the general population. You can imagine that. This is
Yeah.
belong to statistic.
Yeah.
Mm.
Okay. So now we can analyze this case
Yeah.
to to find out what is the answer. So Vân, do you have any concerns about this patient? Any abnormal
All
here?
right. Okay, there are some points I think that we should notice. The firstly, the age of of the child, the 3-year-old boy, and um, mm, and and except the normality, the heart sound shows that a bit there's something wrong here, and that's the murmur in both systolic and diastolic.
Mm-hmm.
Yes, and the split of the S2. Yes,
Yeah, the list of the S2 sound, right?
yes,
Okay.
okay,
Um, and yep, this this try have nearly kind of normal. It's normal try without nearly no clinical symptoms. And he just referred to the pediatrician with the abnormal in the heart sound.
Mm-hmm.
Hmm. I think that's it means that this is try just only kind of um they only they only know about his symptom, his abnormality unintentionally, right? Just like go to the local clinics for vaccinations, and they do the accusation, and they and they they know about this abnormality.
Yes.
That's the reason why I just refer before that. Yeah, it's really important to
Mm-hmm.
hear for the heart sound of an infant, even though he or she have no symptom at all. Okay.
Mm-hmm.
Mm-hmm. So with just only very little symptoms by the heart sounds, we need to analyze to know what is the abnormal, the location of the abnormal in this trial. Um, we need to kind of notice that we have two locations of murmur. Okay,
Mm-hmm.
the first location is the upper left sternal border, and the second is in the lower left sternal border. So do
Mm-hmm.
you remember the locations? Uh, what which valves in these locations? Do you remember?
Yeah. Right. Okay, in the upper left, I think that is the pulmonary. Okay, okay, no. Let's see. Oh, no. In the upper left is the aorta valve in the upper left, right?
The aorta valves,
Yeah.
and the second,
Uh, and the up in the lower left is the mitral valve.
Mm-hmm.
Yeah.
are you sure? Okay, I will refer it for you. Yeah, in the left sternal border, we have two valves, right? The upper is the pulmonary valve, and the lower is the tricuspid valve. Do you remember? Okay, so we know that um, this
Okay.
this tribe have the abnormalities in the two locations, and we can see here if a tribe have the murmur in the systolic the systolic ejection.
Mm-hmm.
Mhm. So um, did it did it kind of refer you to mm, any valves? It is the valve that is opened in the systolic,
Systolic.
right?
Solid.
Yeah, in the systolic part. It is which valve? Which valve is?
Well, in the yeah, in the systolic period,
Mhm.
it is the valve open in this time in this period is um pulmonary and aorta valve, valve.
Yeah, exactly. So it means that um, we have the something abnormal in the pulmonary valves that makes the blood flow to create the murmur. It may be because of the stenosis of the pulmonary valves, or we have kind of
Yeah,
the increased blood flow through the pulmonary valve, right?
Mm-hmm.
So similar to that, we can analyze for the tricuspid valve. In the location of tricuspid valve, the we hear we hear the diastolic murmur.
yeah.
The diastolic murmur, right?
Mm-hmm.
So it refers to which abnormality here?
The yeah. Uh, in the diastolic period, the I'm sorry, the tricuspid, right? The tricuspid valves open
Wow.
in the yeah in the diastolic.
Yeah.
So yeah, so I think that there's some problem with the tricuspid valve, like it can open totally.
It can
Yep,
open. It means that we have some narrowing.
yep.
Yeah, in the way the platform, the atrial, the right atrial to the right ventricle, right?
Ventricle. Yes.
Yeah, exactly. So, oh, sorry. Yeah. So we can here we have six options here. Which is the most appropriate
Oh,
to what we would just analyze?
well,
Which defect will increase the blood flow to the right ventricle and increase the blood flow to the left ventricle?
to the right, right, to the right ventricle.
To the
Um,
right ventricle and the atrial, the right atrial.
oh, I'm sorry. What did you say?
I mean that we've just analyzed that there are some abnormality with the tricuspid valves and the pulmonary valve, right?
Yes,
Mhm.
So the reason for the murmur is because some stenosis, the narrowing, some
yeah,
or something that make the increase of the blood flow through this valve that create the murmur.
yes.
Mhm.
Mhm. So we
All
need
right. Yes, yes. Just you
so
keep
we can
saying.
kind of choose in the six options which defect can create the first thing, the stenosis, the stenosis of the pulmonary valve and the tricuspid valve.
I think that I'm a bit misunderstand. I think that you just said that it has two reasons for the murmur. For the yeah, it's the first one is the narrow of the valve, and the second one is the increase in the blood flow through the valve, right?
Yeah,
Yeah. So okay, according to your suggestion, I think that the reason for this abnormality in this case is the ventricular septal defect, right? I
right.
think that when has a ventricular septal defect, the sound is from the left to the right. So from the left ventricle to the right ventricle. So then it can increase the blood to
Yeah,
right the right ventricle.
yeah,
So
exactly.
it can cause the murmur.
Yeah. So it just only cause the murmur in the pulmonary
Yeah, yes.
valve. So which will what will explain for the murmur in the tricuspid valve?
Mm-hmm. Okay. I think that the increase in the number of okay, let me see.
Just because of increase of blood flow.
Yeah, we need to find some defect that increase the blood flow through the tricuspid valve and the pulmonary valve.
Uh,
You know, that
no, but what can I say?
yeah. So
Of
come
course, I know.
we come from the first to the last. Okay, the first one is patent ductus arteriosus. Patent ductus arteriosus. Um, it's it will create the continuous murmur, right?
Mm-hmm.
Yes,
The sun and it will never close. The
Mm-hmm.
arteriosus never close, so it will create the continuous murmur. So maybe A is not our answer.
yeah,
Okay.
yes.
Um, for the benign heart murmur, do you think it's a benign heart murmur?
Yeah, as I read, a benign heart murmur situation is that except the murmur, the patient has no other signs or symptoms. But
Yeah,
I think
exactly.
first, but I think that it's a 3-year-old boy, and there are so much murmur in here. So I think that is not a benign heart murmur.
Yeah, Actually, the benign heart murmur is quite common in infant and small children. And you know that just only 1% of, of abnormal heart sound in small children is pathology, and
Yes.
99% is a benign heart murmur. But you know, when a local healthcare staff or any healthcare provider who hear the abnormal heart sound in an infant, he al- he always have to think about some congenital defects and refer this child to the pediatrician. So even though it can be benign heart murmur, but we should not think about it is benign at first. We should think it is some pathology, and we
Yeah.
need some thorough examination for this patient for this trial.
Yeah.
Okay,
Yes, and
not every symptom reveal on just only occultations.
mm,
So we
I
need a thorough checkup. So
yeah.
that is the reason why we should not choose this answer.
Yes,
But remember,
I agree with that. I agree with that. But I just want to plus some information about this. First thing, the grade of the murmur from 3/6, they will do investigation. From 3/6, like this is like they will do investigate to see what happened with the heart, because like that's the average. We have a sick rate of the murmur 1 to 6, right? From the 3/6, they will do investigation even they don't have symptoms.
mhm,
Below 3/6, like they if no symptom, they can suspect it, see the benign murmur. The second thing, the patient have the S2 is a widely split and does not vary with the respiration. That's a very important point, but we skip that. Uh, that's the heart sound. The heart sound is not normal. The heart sound is abnormal.
yeah.
That reason why we have to think that it's not like a benign heart murmur.
Yeah,
Yes,
very, yeah, it's very important. Thank you.
yes.
So yeah, so for the D is the D option is the ventricular septal defects. We just analyze that it can create the tricuspid murmur, right? For the E option is a pulmonary valve stenosis. So actually, it can create the diastolic murmur, right?
Yeah, yeah.
So the F is coarctations of aorta.
Mhm.
Coarctation of aortas. We will hear the murmur in the locations of the what of the aortic valve, right?
Yeah, sure.
Aortic valve. Yeah, and um it also creates a symptom of symptoms of differential cyanosis. It means that's a cyanosis in the lower part of the body, because we have it decrease the blood flow to the lower extremity. So the
Mhm.
patient will have the cyanotic symptoms in the lower part of the body. Do you know this?
Yeah,
Yeah.
yeah.
So that is the reason why we should not choose the F here, because our child is totally normal, even though he is 3 years old with no
Mhm.
symptom of cyanosis. Okay, it's not
Um,
the most appropriate answer here. We just only have the C options. It's atrial septal defects. The atrial septal defect, it means that we have a blood flow from the left atria to the right atria. Okay, this right atria. So it will increase the blood flow to the right atria. That's the reason why we hear the murmur through the tricuspid valve.
yes.
So through the tricuspid valve, it will increase the blood flow to the right ventricle. Increase the blood flow to the right ventricle. It means that in the diastolic ejections, in the systolic ejection, we will hear the murmur through
Mhm.
pulmonary valve.
Mm-hmm.
It's totally kind of proper for every abnormal sound that we hear here.
Yep.
Okay, so the C is our answer, the most
Yeah.
appropriate answer for this case, right?
Okay.
Yeah,
All right.
Uh,
clear.
mm-hmm. But for me, when I look at this sentence, I would use the ASD without thinking. You know why? I look at the sign here. Patient have the S2 with is widely split and does not vary with the respiration. That's a typical for the ASD. The
Mm,
typical. Why this typical? That's the sign to help us to differentiate between ASD to another.
yeah.
Beside the murmur. Uh,
Mhm.
I First of all, this we call it this they're not very with the respiration. It means no change with the respiration. It means like the hasa will be fixed and wide split etsu. Split etsu is mean like we have two superior of the S2, we sometimes we call it A2 and the P2, right? The A2
Yeah.
is like aortic valve and the P2 is the pulmonary valve. And
Mhm.
this split, it means like it's not connect together. It means
Mhm.
like something make delay the closure of the pulmonary valve,
Yeah.
right? Yeah, that's very important point to help us like think this is ASD.
Yeah, the S2 split sound is a kind of specific sound for the ASA. For the
Yes.
A, that's the way we remember about this case. But for the person who never know anything about the congenital heart defects, we need to analyze. I think that we should analyze from the murmur first.
Yes, I am very, very surprised with like the way you approach this case. I'm very, very appreciate that because like for me, I just look at direct to this. But
Yeah.
that's a very good way to analyze the whole
Mhm.
picture and to have you in case you cannot listen the ETSU because sometimes you cannot hear that. This for the
Yeah.
test, but for the in reality when we just heard a murmur, that's a good way to approach about
Mhm.
the patient who have the ASD. That's a really good way. I just want to extra information about this.
Yeah. So when do you understand why the S2 split? Are
Yes,
you
I
clear?
understand it.
Yeah.
Yeah,
Oh,
yeah,
thank you.
that's okay.
Yeah.
And
So now we will move. Okay.
just one more thing about the coarctation of the aorta. This not only we have the patient who have different between the lower part and the upper part with the cyanotic and lower part, and this is normal with the upper part. That's the one of the type. This type with the patient who have the coarctation of aorta combined with the PDA. We will see that. Otherwise, if the PDA is closed, it means like this is no change between the SaO2. I mean, it's make different between the oxygen level from the upper and the lower part. You know.
Mhm.
So for the coarctation of the aorta, we will recognize that based on the hypertension, like the difference between the blood pressure.
Yeah.
Yes,
Exactly.
yes,
It's,
yes. That has more than the SaO2, the
yeah.
cyanotic or acyanotic.
Yeah.
Yes, just that. I think that's helpful. Like I agree, we can have this tie in case like we have the PDA.
Mhm.
Otherwise, when this is closed, maybe after a few, sometime it will close the PDA, so we cannot see the difference between oxygen level.
Yeah.
So
Exactly.
yeah, yes, just that.
So that's the reason why when we go through the cardiology department, our teacher
Mm,
always remind us that we should check for the blood pressure of the patient in the upper limb and also in the lower limb,
yes,
because
correct.
yeah, the difference between upper and lower part of the body will kind of refer to some abnormality in
Yeah,
the, and
yeah.
it's very important, even though it's really kind of simple.
Mm,
But
yeah.
we always we not all the way, but we sometimes
It's
yeah,
helpful for some case, especially for coarctation of the aorta, because not only for the children, but also for the adults too. This can
Yeah.
happen with adults. Yes, I agree with that.
Okay.
Yeah.
So we will end this case here and we will move to the next case. I think
Yes.
that's the second case with much faster than the first one because we know how to think, how to analyze a case. Okay. So
Yeah, that's
now
really, really good. Yeah.